Now, our today's topic is rest. What are rest? Rest is a part of partial denture framework that provides a vertical support. Essentially, it helps to hold the denture in correct position in your mouth. It is like a ledge that sits on your tooth to support the denture. According to McCragen's and according to GPT, these are the standard definition of the rest. What is a rest seat? Rest seat, it is the specific area of the tooth that is prepared to hold the rest. Think of it as custom shaped spot on the tooth where the rest will sit snugly. Now, what are the types of, according to the classification or to the McCragen's, they can be rest, can be occlusal rest, cingulum rest, incisal rest, or lingual rest. Occlusal rest is placed on the occlusal surface of the tooth. It is common choice because it directly supports the denture and help with proper load distribution. Other is the lingual rest. It is situated on the inner surface of the tooth, that is the side facing the tongue. And this rest is particularly useful on canines and incisors. Incisal rest, Incisal rest, it is found on the edge of anterior teeth. The rest is used less frequently, but it is sometimes necessary for certain cases. Other is the extended occlusal rest. This type is larger and extends over the bigger area of the tooth occlusal surface, providing more support. Other is the interproximal occlusal rest. These are placed between the teeth where rest sits on the sides, which helps in maintaining the proper alignment of the partial denture. Other type of rest is intracoronal rest. These are located inside the crown of the tooth. They are often used when dealing with a tooth that has been prepared for the restoration. Now, according to the Stewart classification, the rest can be primary rest or secondary. Other name is auxiliary rest. According to the Kratos, on basis of location in the arch, rest can be anterior rest or rest can be posterior rest. Now, why are the rest important? First of all, they keep the partial denture in a planned position within your mouth. So they maintain occlusion relation, occlusion relationship. They help to maintain the bite by preventing the denture from shifting or fettling. They prevent soft tissue impingement. By supporting the denture properly, they avoid unnecessary pressure on the gums and other soft tissue. Third is it distributes the load. The rest directs the occlusion surface to the abutment teeth, which helps in distributing these forces evenly and reducing the stress on one area. The primary job of rest is to support the partial denture against the forces of the occlusion. So when you bite down, the forces generated are directly to the rest. The rest helps to distribute these forces evenly to avoid excess stress on any single tooth or part of the denture. By doing so, they help to prevent the damage to the denture and teeth that supports it. So, they direct the forces of mastication. The rest are designed to channel the occlusal forces along the long axis of the abutment tooth. That is important because teeth are strongest and most stable when the forces they are applied along the long axis. Second is maintaining the retentive terminal of class arm in its intended position. The retentive terminal of class arm, it is a part of the denture framework that keeps the denture securely in place. So rest, it helps to ensure that these parts remain in their correct position. It prevents the denture base from fitting past its intended position. It gives a lateral stability against undue horizontal stresses to the soft tissue of the ridges. So these are the functions. So what are the basic consideration for reft in a removable partial denture? While designing and placing reft for removable partial denture, there are key factors to ensure that forces applied are managed effectively and the denture functions optimally. First of all, the force transferred, force exerted on the removable partial denture must be directed to the sporting teeth and surrounding tissue in a manner it does not cause damage or discomfort. The goal is to ensure that these forces are distributed in a atraumatic fashion. So minimizing the risk of trauma to the teeth and soft tissue. Second is ref should be steadily placed in the properly prepared ref seat. The ref need to be securely placed in properly prepared ref seat. This means that the preparation for ref should be done meticulously to ensure a stable and durable fit. So a well-placed ref provides reliable support and helps them maintain the denture position. The third is that the ref should be within the confines of greatest tooth mass, more PDL fibers. The ref should be located within the areas of tooth that has greater mass, particularly where there are more periodontal ligament fibers. So that ensures that tooth can handle forces applied through the ref more effectively. Avoid placing ref on the inclined or sloped surfaces of tooth, as these are less stable and can lead to improper force distribution. Now let us discuss the design of the ref seat. The ref seat should be have smooth rounded contours. Sharp angles can create point of stress. There should be no sharp angles. Sharp angles can create point of stress and increase the risk of damage to the tooth and the denture. The seat should be rounded to evenly distribute forces and minimize the stress concentration. Minimum thickness is 1 mm thick. The ref seat should be prepared to minimum thickness of about 1 mm. So this thickness is necessary to provide sufficient strength and support for the ref while ensuring the durability and effectiveness. There should be no undercuts in the path of insertion. The ref seat preparation should avoid any undercuts or irregularities that could interfere with the insertion and removal of the partial denture. Now the underdenture, they can create difficulties in fitting the denture properly and may necessarily lead to discomfort or functional issues. So designing ref seat, the tooth must be properly prepared to receive a ref seat that involves shaping the tooth to create a stable area for the rest. Now reft can be primary reft. Primary reft is type of reft integrated into retentive clasp assembly of removable partial denture. It is designed to provide essential support and stability to the denture. The primary rest helps to prevent the denture from moving vertically toward the soft tissue. That is important for maintaining proper Fit and function of the denture. It helps in transmitting the forces applied during the chewing to the supporting structure that helps to distribute the load evenly and minimize the stress on any single tooth or area of the denture. Now remember, the design should be, ref should be shallow and have saucer-like shape. So this design provides stability and prevent excessive stress concentration. Functionally, as a ball and socket joint. Ideally, the primary ref should function like a ball and socket joint, allowing for slight movement and adjusting while maintaining a secure fit. Other is the auxiliary rest. Other name of auxiliary rest is the secondary rest. So rest that is responsible for additional support or indirect retention is known as auxiliary or the secondary rest. So auxiliary rest or secondary rest, they are additional rest that provides extra support or indirect retention to removable partial denture. So they are not the primary means of support but play a significant role in enhancing the overall stability. Function. These rest add supplementary support to the denture, especially in the cases where the primary rest alone are not sufficient. Remember, in the extension basis, removable partial dentures such as those used in class 1, class 2 or long span class 4 application, auxiliary rest, they are important for indirect retention. They help to prevent the movement of the denture away from the supporting tissue and thereby enhancing the overall retention and stability of the prosthesis. Now let us discuss the various forms of rest. It can be occlusal rest. This is the standard definition according to the GPT classification. Now the rest, remember, it should have a round triangular shape. The apex of this triangle should point toward the center of the occlusal surface of teeth. So that this shapes helps in distributing forces evenly and providing stability. The rest should be as long as it is wide. So this balanced dimension ensures that there is enough surface area for effective support and proper fit of the rest. The base of triangular shape which aligns the marginal ridge should be at least 2.5 mm for both molars and premolars. So that means that there is sufficient metal bulk to provide the necessary strength and rigidity of the rest. Smaller rest may not provide enough metal bulk which can compromise the strength and functionality of the rest. Third is the marginal ridge reduction. To ensure a sufficient bulk of metal for both the rest and minor connector, the marginal ridge of the abutment teeth need to be reduced by approximately 1.5 mm at the site of the rest seat. The second is the floor of the occlusal rest should be positioned below the marginal ridge. The floor of the occlusal rest seat should be positioned below to the marginal ridge and the occlusal surface of the tooth. It should be concave or spoon shaped. So why it is concave? It helps in accommodating the rest securely and provide a smooth surface that distribute occlusal forces effectively. Avoid any sharp edges. Care should be taken to avoid creating sharp edges or line angles during the preparation of the rest seat, as these can cause discomfort and interfere with the fit of the partial denture. Remember, the angle formed by occlusal rest and vertical minor connector from its originates should be less than 90 degree. So this configuration ensures that the occlusal forces they are directed along the long axis of the abutment teeth. So if the angle is greater than 90, the forces might not be transmitted properly along the vertical axis. So that can lead to slippage of prosthesis away from the abutment and can lead to unwanted tooth movements. Contour of the occlusal reft. The occlusal reft should follow the contour of the mesial and distal marginal ridges. And the triangular fossa of the tooth. So this alignment ensures that the reft will fit into the natural tooth and maintain the proper distribution of forces. Second is the size of occlusal rest. So the buccolingual width of the occlusal rest should be 1/2 of the width between the cusp tip of tooth. So this dimension ensures that there is sufficient area for effective forces distribution without compromising the tooth structure. The mesiodistal diameter dimension, the size of occlusal reft should be 1/3 to 1/2 of the mesiodistal width of the tooth. So this range helps in providing adequate metal bulk for strength and support while fitting well within the tooth natural dimension. So why these dimensions are important? Following these size guidelines ensures that the occlusal rest has enough metal bulk to provide strong support and withstand the forces of mastication without deforming or breaking. So the proper dimension helps in distributing the occlusal stress across the tooth that is essential for maintaining the stability of the partial denture and preventing the damage to the abutment teeth. So reduction of the marginal ridge 1.5 mm that has been already discussed. So when the reft seat, remember, it crosses the marginal ridges, the thickness should be between 1 to 1.5 mm. So marginal ridge, it is a critical area of the tooth that bears a significant portion of the occlusal load. Increasing the thickness at this point helps in providing additional strength and rigidity to rest, preventing it from bending or fracturing. So why proper thickness is important in preventing the fracture? Adequate thickness helps in distributing the occlusal forces during chewing evenly across the rest seat and the tooth structure. Insufficient thickness can lead to stress concentration and may fracture or cause a deformation. Now here is the rest seat preparation in sound enamel. Always prepare the proximal surface before preparing the occlusal rest. So that ensures the rest seat is accurately positioned and the overall fit and function of partial denture they are optimized. Use diamond point of number size 6 and 8 or carbide burrs for preparing the occlusal rest in sound enamel. So that ensures, so these tools helps in achieving necessary shapes and dimension for a strong and functional rest seat. Now rest seat preparation in existing restoration, as with the sound enamel, begins by preparing the proximal surface of the existing restoration. Once the proximal area they are prepared, proceed with the occlusion reft. Reft preparation in amalgam, it is generally advised to avoid preparing occlusal surface in the amalgam restoration. This is due to the amalgam tendency to undergo creep over time that can affect the stability and accuracy of the rest seat and overall partial denture. The occlusal reft in a new restoration. For new restoration, the rest should be incorporated into the wax pattern during the initial stages of restoration design. When preparing a tooth for crown or inlay, clearly indicates the location of the occlusal reft, so that helps in providing adequate clearance within the preparation to accommodate the rest and ensure a good fit for the partial denture. Next, moving to the extended occlusal reft. Extended occlusal reft, they are important in certain situations to optimize the stability and support of removable partial denture, especially when dealing with tipped molar teeth. Or severely tilted abutment teeth. So it is a clinical indication. It is done in Kennedy class 1 modification and class 3 situation. So this situation often involves the posterior abutment that are measly tipped, and extended occlusal reft helps to minimize further tipping and ensures the forces that are directed down the long axis of the abutment teeth. The extended occlusal reft should cover more than the one half of the mesiodistal width of the tooth, so that extension will provide adequate support and helps in stabilizing the abutment. The buccolingual width should be 1/3 of the buccolingual width of the tooth. The dimension ensure that the mesiodistal occlusion reft should cover more than the 1/2 of the mesiodistal width. The buccolingual should be approximate 1/3 of the buccolingual width of tooth, so that ensure that the reft is wide enough to distribute forces effectively without compromising the structural integrity. Ensure a minimum thickness of 1 mm of the metal. So that thickness would provide sufficient strength and rigidity to the reft. Now the shape, the preparation shape should be round with no undercuts or sharp angles. So in case where the abutment teeth is severely tilted, the extended occlusal reft may be designed as only to restore the occlusal plane. That helps in aligning the occlusal surface and providing necessary support. Coming to the lingual reft. Lingual reft, it's the what is lingual or cingulum reft and where they are typically prepared. The lingual reft, it should be are the reft that are prepared on the lingual surface or above the cingulum of the anterior teeth, and primarily it involves the maxillary canine. So these reft are designed to provide the support and help and distribute the occlusal forces along the long axis of tooth. They are generally fabricated on the maxillary canine. And cingulum reft cannot be prepared on the mandibular canine due to the inadequate thickness of the enamel. So why are cingulum rest preferred over incisal rest? Cingulum rest are preferred over incisal rest because they are situated closer to the center of rotation of tooth that minimize the tipping forces. They also transfer occlusal forces more effectively along the long axis of tooth and are more aesthetically pleasing. What are the key design or characteristic features of cingulum reft? Cingulum reft should have a half moon appearance. Extended as a smoother curve from one marginal ridge to the other. The preparation should cross from the center of tooth incisal to the cingulum and line angles should be rounded. The preparation should cross from center of tooth incisal to cingulum and line angle should be rounded. The ref seat typically has a V-shaped boomerang. Or boomerang shaped, and the mesiodistal width should be around 2.5 to 3 mm. Under what condition is preparation of lingual reft indicated? Lingual reft preparation it is indicated when cingulum is prominent, the patient maintains good oral hygiene and caries index is low. So these conditions ensure that the cingulum reft will be functional and durable. So preparation should have a minimum 2.5 to 3 mm in mesiodistal length. The width of rest seat should be around 2 mm and the depth of incisal apical depth should be around 1.5. The floor, remember the floor of the rest seat should be angled to be less than 90 degree relative to vertical minor connector from which it originates. This angulation helps to direct the forces along the long axis and minimize the tipping forces. Now coming to the round lingual rest seat form. So when to use the round lingual reft, it is typically spoon shaped similar to occlusion reft in design. So this shape helps to distribute forces effectively while adapting to the contour of tooth. Preparing a round lingual reft can be more challenging due to the incline of the lingual surface. So in case where a typical cingulum reft is contraindicated due to large restoration, lack of clearance or poor cingulum definition, a round lingual seat can be used. So this preparation is spoon shaped similar to occlusal rest seat and it is designed to adapt to the tooth contour. However, the preparation is more challenging due to the incline. Now coming to the lingual rest on the cast restoration. So when preparing a lingual reft or cast restoration, where the reft sheet should be placed, the reft sheet should be placed in wax pattern before the cast restoration is finalized. So that ensure that reft sheet is integrated into final restoration. So when you need to prepare a lingual reft for cast restoration such as crown, the reft should be incorporated into wax pattern before the final casting. How should the floor of reft sheet be carved in relative to tooth preparation? The floor of reft sheet should be carved to the most apical portion of preparation. So that would help to ensure that reft sheet is well supported and aligned with the long axis of tooth. On what type of cast restoration can lingual reft be placed? The lingual reft can be placed on various types of cast restoration, including cast veneer crown, a three-quarter crown, inlay, laminates, veneers, or composite restoration. Saddle-like shape can be given. What shape should the rest seat have? The rest seat. Hello. Hello.
हेलो
हाँ जी।
बोल डॉक्टर पूरन हॉस्पिटल।
हाँ जी।
हाँ जी सर वो ट्रीटमेंट हो रहा चल रहा था ट्रीटमेंट।
आ जाओ आना तो।
और तो कितनी बैठे हो?
हाँ जी।
चल ठीक है ठीक।
The rest sheet should have a saddle-like shape. This shape provides a positive rest seat that is favorably located in relation to the long axis of tooth. Now, what are the coming to the incisal rest? Why are the incisal rest considered less desirable compared to lingual rest? The incisal rest they are less desirable than lingual rest due to aesthetic concerns and potential for increased stress on the abutment teeth. They are often used in situations where the lingual rest are not feasible or as auxiliary rest for indirect retention. So incisal rest are generally considered less desirable compared to the lingual rest because they are less aesthetically pleasing and place more stress on the abutment teeth. Lingual rest are preferred for their better alignment with the long axis of tooth and improve aesthetics. So where should the incisal rest be placed and what are the preferred site? The incisal rest are typically placed on incisal edge of the anterior teeth, particularly on the mesio-incisal or disto-incisal angle of the tooth. If aesthetic are concerned and no clasp is to be placed, the disto-incisal angle is preferred. They are usually placed 1.5 to 2 mm away from the proximo-incisal angle of the tooth. So what are the dimension and shape of the incisal rest? The incisal rest, it should measure 2.5 mm mesiodistally and 1.5 mm occlusogingivally. The deepest part of preparation should be oriented toward the long axis of tooth mesiodistally. The nose should be smooth to avoid any stress concentration. The incisal rest should have V-shaped notch with a dimension of 2.5 in width mesiodistally, 1.5 occlusogingivally. The deepest part of preparation should align with the long axis to distribute forces effectively. So what specific consideration should be made when preparing incisal rest on cast restoration? It is important to avoid placing it too close to proximo-incisal angle. The preparation should be slightly into the facial surface to act as a locking device. That helps to prevent any tipping forces. Incisal rest they are contraindicated in cases where cast restoration are planned for anterior teeth due to potential aesthetic concern and risk of undermining the restoration. Instead, a lingual rest should be incorporated into the wax pattern of the cast restoration to provide a better support. So what is the main difference between the alternative cingulum rest and conventional inverted V design? The inverted V design to engage a prominent cingulum, the alternate design that was designed by and described by Ivanhoe. He does not rely on the cingulum prominence. Instead, it uses a broader saddle-like shape that can be adapted to teeth with less prominent cingulum. In which condition does full incisal reft may be indicated? The full incisal reft, they are indicated in when the morphology of tooth does not allow for alternative reft design, when there is loss of incisal angle, when additional stability is required for partial denture, when the guidance is needed for placement of restoration. So here the full